This video was produced by the group C12 and contributed by Joseph, Diana, Michael, Varney, Felix, Emma and Abdinazir. This new drug is called Aciclovir and it comes in many forms. It also won the Nobel Prize in 1988.
Okay, so what I'd like to know about Aciclovir is the structure of the drug, what it's used for, how the drug was discovered, how the drug was developed and synthesized, the mechanism of action, and the side effects.
Yeah, of course, we will cover all of that, but let's have a quick look at the structure first. This is the structure of Aciclovir, and let's just pause for a second and see what functional groups you can identify.
Okay, I can see that the structure has an amide, an amine, a primary alcohol, a pyrrole, an imidazole, and an ether.
Yeah, that's correct, that's brilliant. Okay, here's another question then. Does this structure apply to Lipinski's rules if I told you that the log P is minus 1.83?
I believe it follows Lipinski's rules, as these state that a good guideline to follow to achieve good oral bioavailability includes properties such as no more than 10 hydrogen bond acceptors, no more than 5 hydrogen bond donors, a molecular weight less than 500 grams, and a log P no greater than 5. In the case of Aciclovir, it has 6 hydrogen bond acceptors, 3 hydrogen bond donors, a molecular weight of 226.09 grams. Other factors that improve oral bioavailability include less than 10 rotatable bonds, in this case Aciclovir has 4, and a polar surface area less than 140 angstroms. Aciclovir has a value of 114.43 angstroms.
So now that I know the structure, what is it used for?
Aciclovir is used in patients to treat viruses. As you know, a virus can be transmitted by direct contact from one infected person to another.
Yes, I also know that herpes simplex virus 1 produces cold sores, and HSV2 produces genital herpes.
Yes, that's true. Also, symptoms include watery blisters on the skin or mucous membranes, such as lips. Cold sores affect 50% of the population.
Is it also true that chickenpox, as well as shingles, is called by varicella zoster virus? Chickenpox mostly occurs in children, as well as adults who didn't have it as kids.
Yes, that's correct. The virus is spread through the fluid in chickenpox blisters and can be caught in several different ways, including contact with contaminated surfaces, toys, touching the blister, or even being in the same room with an infected person. Chickenpox appears as red spots at first, which then become itchy blisters. After appropriate treatment, the blisters will dry out and will then start to form scabs. After a person's had the chickenpox, the virus stays in the nerve cells, but it's not active. Reactivation of the varicella zoster virus causes shingles, even though it is not known exactly how or why this happens.
I heard it mostly occurs in times when a person's immune system is compromised due to factors like old age, stress, or HIV and AIDS. So now that that's clear, how about you tell me about how Aciclovir was discovered?
A screening program for antiviral drugs began at the Wellcome Research Laboratories, which is now called GlaxoSmithKline, in the 1960s. It resulted in the discovery of Aciclovir in 1974 by Howard Schaefer. After Schaefer's discovery, Gertrude B. Ilian and a team of other researchers studied how it worked, and why it was so non-toxic. They discovered that Aciclovir remains inert until it meets the herpes virus. For 4 years, from 1974 to 1977, more than 75 researchers kept Aciclovir secret. The first report detailing the selective antiviral activity for Aciclovir herpes viruses was published in 1977. It was brought to clinical trials, and the first form of the drug, which was topical, was available to physicians in 1982. Aciclovir got FDA approval and was released commercially in 1982. It became available in oral formulations, which were the 200mg capsules, in 1985. Moving on to 1988, the patent ended and generic brands packs became available. In 1990, Nobel Prize was awarded to Gertrude Ilian and the colleagues for their discovery of important principles for the drug treatment. Moving on to the modern day, in 2016, Aciclovir was on the WHO's list of essential medicines, and it's considered gold standard of today's medicines.
So during those 4 years from 1974 to 1977, what developments were made?
Well, it was originally formed as a synthetic analogue of cytarabine, which is a marine source, and later developed into aciclovir. However, aciclovir showed poor aqueous solubility and it wasn't well absorbed after oral administration.
So how was this improved?
Well, that's a good question. Instead of hydroxyl group amino acids such as glycine or alanine, ethers were added to form glycol or anisyl aciclovir or valacyclovir. The chosen manipulation depends on the intended preparation, whether that's topical or oral. So focusing on how it's synthesised.
Benzoyl chloride reacts with ethylene glycol. This then reacts with a ketone, which then reacts with an electrophile. Finally, alcohol and ammonia are used to produce the final product, aciclovir.
Okay then, so this is an antiviral drug. Let's revisit how a virus actually enters a cell.
Okay, this I remember. So to begin with, a virus enters the body and attaches itself to a host cell. It then injects its viral DNA into the nucleus of the cell. The viral DNA then mixes with the host's DNA. It replicates using existing machinery in the cell. It then assembles itself and can now leave the cell to infect others.
That's true, so an antiviral drug will be incorporated into the growing DNA strand, as it were another sugar-based phosphate unit. Aciclovir is an analogue of 2-deoxyguanosine. The structure of aciclovir is altered when it is phosphorylated in infected cells. This is by the viral-induced thymidine kinase initially, but then various other kinases within the cell. Aciclovir, like other antiviral drugs, will be incorporated into the growing DNA or RNA strand as if it were another sugar-based phosphate unit. Once the drug is incorporated into the growing DNA strand, no other sugar-based phosphate unit can be attached, and so any further growing stops, hence termination of the growth of viral DNA.
So, will there be any off or on-target side effects?
There are both off and on-target effects.
And what are these?
Aciclovir can affect the nervous system. It's commonly reported from patients with renal failure and associated with high serum concentrations of the drug. It could include side effects like aggressive behaviour, coma, confusion and decreased consciousness. But following discontinuation of aciclovir, mental station should recover within a week. It could also affect the renal function, especially in the elderly and those that are already renally impaired. It's commonly due to the crystallization of the drug in the renal tubules. It induces effects such as renal failure, renal pain, and elevated blood urea nitrogen and serum creatinine levels. However, these renal side effects should be resolved after several days following the discontinuation.
So when might I see a prescription for aciclovir?
Well, in the pharmacy, you may see it in the treatment of shingles at a dose of 800mg 5 times a day for 7 to 10 days. It's also used in the treatment of genital herpes at 200mg 5 times a day for 10 days, but also in its prevention when it's used at 400mg twice a day for 12 months. It can be used in corneal inflammation, where an ointment is applied 5 times a day for at least 3 days. And it's also used in chickenpox in both adults and children who have the same dose of 800mg 4 times a day for at least 5 days.
Thank you. This video has been really educational. Aciclovir looks like quite the effective drug. Seems to have good treatment for cold sores, chickenpox and shingles. I've identified the functional groups, I understand how the drug was discovered, developed and synthesized. The side effects seem tolerable and production looks suitable. I'm sure I'll see it in my pharmacy soon.
Great, I really hope you enjoyed this. Thank you for watching and a well done to Group C12.